Good morning, everyone, and welcome. Welcome to this meeting addressing research gaps at the intersection of climate change, health, and equity. I'm Dr. Victor Dzau, the president of the National Academy of Medicine, and I'm really happy to open this meeting. This meeting is supported by a grant from Kaiser Permanente, and you're going to hear from Bachera Shokir later on in his welcoming remarks. I am to set the stage for this meeting, and it's really a great pleasure. So this issue, climate change, health, and equity, is a major issue that's facing this nation and, of course, globally. May I have the first slide, please? I think what's really important in this issue is the fact that climate change always seems to be an environmental issue, and that it affects the environment and also future generations. But I want to really tell you that climate change is a public health issue, a crisis, which are now and urgent, and also is a major equity crisis. Next slide. So if you look at the data, it's very clear that climate change is already affecting human health. Extreme temperatures, 5 million deaths a year globally. Air pollution, 8 million deaths a year, of which 5 million relate to fossil fuels. Vector-borne disease, and of course, many other like floods, hurricanes, and famine and drought, all told is causing millions and millions of deaths a year. So it's a human dimension, it's human suffering. And in fact, the McKinsey report for the World Economic Forum says that by 2050, we can expect another 14.5 million additional deaths due to climate-related events. And it's not only deaths, but also morbidity, because if you look at the overall impact, it will be driven by increasing morbidity as well as mortality. Consequently, you can imagine it will exacerbate non-communicable disease, mental health, respiratory cardiovascular disease, disability, injury, or vector-borne disease. The cumulative health system cost is about $1.1 trillion by 2050. It's huge. So I just want to make an impel on you to say that climate change is a public health crisis. It also has tremendous economic and social impact, as estimated again by McKinsey study. By 2050, 12.5 trillion economic loss and up to 1.2 billion of climate refugees. It is a humanitarian issue. So we at National Academy of Medicine have said that addressing climate change is an urgent and existential threat to human life, health, and well-being. It's our top priority. That's in our strategic plan. Next slide. Now, so how do we address climate's impact on health? Well, it's really important to first make sure people understand that climate change is all about human being, human dimension, human suffering, human health, human deaths. So strategies addressing them include, as you know, mitigation, adaptation, policy, data, and research. In mitigation, there are many, many efforts in science and innovation to see how we can reduce carbon emission. Adaptation, particularly in marginalized community, low-income communities and low-income countries, how to adapt to this climate change, particularly extreme heat and others. Policy, making the right policy for us to be able to intervene and prepare for climate change. And most importantly, equally important is data and research. Why data and research? Because without data, we won't know what to do. But with data, we can understand the complexity of climate change, including what are the causes, what are the impacts, and what are potential solutions. We can uncover patterns, trends, and relationships that may inform mitigation efforts. We can identify feasibility, scalability, and potential impact of solutions. Of course, we want to track progress, but also provide the evidence base for policymakers to design and implement effective solutions, and of course, importantly, raise public awareness about the urgency and need to action. I still argue that, in fact, the public is not quite aware of the horrific effect of climate change on human health. Next slide. So today we're going to talk about research innovation because, as I said, it's so important to have that information. to help us design interventions and to track progress. Next slide. So where are we in this? Well, you see in the next few slides that climate health evidence is really dominated by studies from high-income countries like the United States and China, but scanned from low-income countries. So we don't really know a lot what to do in the countries in Africa, Southeast Asia, and others. Secondly, is health outcomes and climate-related hazards are most studied, like air quality, heat-related morbidity, mortality, respiratory illness, seasonality, extreme weather events, and heat, cold, and others. But there are areas that is not a well studied, but they clearly represent opportunities, such as what are the mitigation, adaptation, responses? What are the benefits, the health and human suffering? And of course, mental health, undernutrition, migration, maternal childhood, and inequities are understudied. So we need a lot more research and evidence linking climate impacts with health effects. We need to synthesize what we have, but to make it more accessible for digestion for decision makers. Next slide. So this map comes from a 2021 Lancet study, which the authors provide a comprehensive systematic map of a scientific literature on climate change and human health. As you can see, the dots, they are concentrated in the United States, Europe, India, and China, the higher income countries or upper middle income countries. But if you look at vulnerable regions such as Central Asia, North and Central Africa, South America, they have really much fewer studies and they're underrepresented in the literature. So there's a lack of evidence from these regions despite potential climate effect on these areas. If you look at distribution of topics across the world regions, they reflect mainly national burdens of disease and regional research capacity. So topics like mental health, agriculture, environmental migration receive much less attention across all the countries. Next slide. Here's a paper published that reflects on North America research from 2013 to 2020. And here you can see the bars show you the number of papers published. Suffice to say, cardiovascular outcome, respiratory outcome, mortality, heat are major ones which are being studied. Much less are studied areas of vector-borne disease, maternal and fetal health, nutrition, mental health, and others. So you can see, and of course, what doesn't even appear is the whole displacement, the refugee, the conflict that come from climate crisis, the improvement, the impoverishment, the poverty, and the policy. So you can see that we have a really unbalanced research portfolio to date on climate change. Next slide. So what do we need? I think limitation, data availability, and modeling means there are multiple gaps. For example, regional and context-specific impacts. How's it impacting, for example, in Africa, in South America? What are the long-term health impacts on everybody, United States and elsewhere? Impact on vulnerable populations. United States, we don't have enough knowing about the low-income countries, those who bear the brunt of climate change, and effectiveness of adaptation strategies, how we're responding to it, and how to communicate these issues. Certainly, when we look at data, and the data just like in COVID-19, we really don't have disaggregate data. So we don't understand women more affected, what kind of race and ethnicity. We do know that elderly and those with chronic disease are more affected. So the gaps limit the ability to make impacts, to track, to look at particularly vulnerable populations. We also find there's inequities in funding and infrastructure for data collection, synthesis analysis, and of course, policymakers depending on these data. And the problem is that they have to tackle misinformation, and we have to look at what are the gaps in that data. So I think it's very clear to me that we need to build partnerships from public, private, to science, all the way to policy. Next slide. So today we are going to talk about building a research agenda. And this is what we're working on with a grant from Kaiser Permanente. Next slide. And you'll hear very shortly from Shanae Taylor, who leads this project, about what we're doing. But I just want to tell you that the NAM has taken this issue very seriously. So we launched a grand challenge in 2020 to tackle the entire issue of climate change, human health, and equity. And it's true public-private partnership, and it's global as well as the US. It's chaired by Dr. Judy Roden, the former president of Rockefeller Foundation. We have almost 200 collaborators across our different works as a true private-public collaboration, because the Assistant Secretary of Health, Dr. Rachel Levine, and the Office of Climate Change and Health Equity is a part of this collaborative. In fact, Rachel Levine co-chairs the decarbonization collaborative with me. It involves private industry, biopharma, medical device supply chain, but also, of course, health systems, education entities, policymakers, and engaged global academies. We have 5 strategic objectives. One is to communicate to the world, to the public, to ourselves, that climate crisis is a public health equity crisis, as I've told you. To work hard to reduce carbon emission from the healthcare sector. As you'll hear later on, healthcare sector actually emits 8.5% of total carbon of the United States. That's very high. So we move together to try to reduce carbon emission together in the entire sector. We're looking at the whole roadmap, look at how to bring together other sectors which are responsible for climate change, such as agriculture, energy, transportation, and others, and look at their impact on human health. Accelerate research innovation, which I'll talk about, and then reduce climate-related inequities, which is so important in everything that we do to make sure that we address the issue of equity. Next slide. So in that context, Shanae would tell you that with the funding from Kaiser Permanente, we are looking at research gaps so we can develop a research agenda for the nation and globally. We look at critical evidence gaps related to climate and health and equity, and then understand which intervention strategy can best target. So as you can see, the bullets, which Shanae will tell you more, we interview experts, we do systematic review of all the literature, we design better communities and leaders to understand the racialized climate impacts and implications, particularly in terms of illness and disease. We identify areas of needs, opportunities for further engagement, high priority action items for science, funders, researchers, community members, and policy. The whole idea is that we want to support evidence and tools portal so that there's a database to support research-informed action. So all that is what we are doing right now. Next slide. I'm going to give you some of my own thoughts. This is something I put together in the talk I gave earlier to say, as I think about it, what are the research gaps? You're going to hear some of them today in more detail. First, we need to understand the biologic and environmental pathways. How does climate change affect health? What is a biologic mechanism, and what are the pathways that affect health? Understanding those, of course, will enable us to come up with therapies and interventions. Second, of course, is we need to understand impacts not only in health sector, that is hospitals and others, but also all the other sectors that impact on climate change, and they also impact on health. Third is, what about health sector itself? Our hospitals, our clinics, our supply chain, what kind of innovation do we need? What kind of things do we need to understand to reduce carbon emission and to improve human health? Industry play a very important role. Supply chain responsible for 60% or more of the health sector emission. So pharmaceutical, device, transportation, supply, what kind of innovation do they need to reduce carbon emission? Data, understanding, as I said, data, the gaps in building capacity, particularly in vulnerable communities. Then, knowing what we know, how to implement the interventions in those communities and everywhere. How to bring new technology, particularly AI and modeling, as you hear later on. And of course, you need to build an entire research infrastructure ecosystem. And finally, how do you make sure there's enough funding? Funding that's not siloed, but across NIH, NSF, and all the foundations. So it's important to create a research agenda, which will help input across the health sector, as well as those affected communities, policymakers, and private funders. Such a research agenda must be international, multidisciplinary, community co-developed with emphasis on equity. Last slide, please. So what you're going to hear today is that climate crisis is a public health and equity crisis, and they have continued impact on human health and well-being if it's left unabated. We need bold and new approaches to research and funding in order to address this issue, because research and data will enable evidence-based intervention and policy so we can improve health outcomes and reducing climate change impact. And the areas I believe are gaps are listed here, which I already have gone over. You're going to hear some of these described in much more detail. So thank you very much for being with us today. It's going to be an exciting day. We're going to try to tee up what's needed. You're going to hear from some of the experts what they're doing. And so I hope that from this on, we'll all work together to enhance research, innovation in climate health and equity. With that, I'd like to turn over to Sinead Taylor, who's the Deputy Director of Programs at National Academy of Medicine. She also leads this initiative, and she'll take over at this point to introduce her comments as well as that from Kaiser Permanente. Sinead, over to you.